Michael, a 23-year-old college student, returns to Dr. Yawn's office after meeting with Dr. C, an asthma specialist.
Hi, Michael. It's good to see you again. How was your visit with Dr. C?
Well, you were right, Dr. Yawn. It did take a long time to see Dr. C, especially because it was right around my finals and graduation. But I did meet with her about 2 weeks ago, and we talked about how my asthma has been getting worse. The pills and the inhaler, they're clearly not working well enough because I was sent back to the ER again. And it's important that I kind of get this taken care of just because I'm starting my new job next month and I don't want to be running back and forth between the ER and the hospital.
I understand. But congratulations on your graduation. That is terrific. It's definitely a big accomplishment. And you're right. We don't want you in the hospital in the ED, but we also don't want you just feeling lousy every day. We want your asthma under good control. And so I have a letter here from Dr. C, and it talks a little bit about some of the things that you did, and maybe about starting one of the biologics. You talked about that. Is that right?
Yes, we did. She said there are new medications, biologics, like you mentioned, that could actually help the asthma. We talked about a couple of different options, but it seems like with this one, you actually take it in shot form, and it's not every day, it's every couple of weeks or months, which I really like. I kind of wanted to know what you think about it. Has it worked for your other patients, and do you think it's safe?
Well, I have had a few patients on the biologics. One of them we've had around for many years, and so I've had several patients on that one. These are the medicines, as you said, that you have to take by injection, either a shot in the arm or one that goes intravenously. The new ones seem to work really well for several patients, and I haven't had anybody who's really had problems with them, so I really do think they're very safe.
Dr. C said most patients who take these new medications can stop the prednisone. I told him about how anxious it made me feel and the trouble sleeping at night.
Well, yes, Dr. C was talking about you needing to take those steroids less often, and that's exactly what we want to do, is get you off those steroid pills or the prednisone. But I'm sure that she did say you have to keep taking all the inhaled medicines still. In time, we may be able to get you off some of those too, but our first goal is for you not to have any of those asthma attacks, not need any of those steroid pills. And then we can look at the other medicines over time. Usually 2, 3, 4 months, we might be able to step down, and she'll be taking care of that part of it. But it's important that you stay on the biologics, give them their fair chance. And do you have any questions for me before we take a closer look at the letter for the next step? Anything else you need to know?
No.
Okay, so let me take a closer look at this letter with you now.